Will children be given the vaccine is another question. Dr. Kasim, do you want to take that one?
At this moment in time, children are not part of the vaccination schedule, and that's because, as Bernard mentioned earlier, it's not something we do with new immunizations or vaccines. But my understanding is that they are. Bernard knows about this, but they are going to be, aren't they, Bernard?
They are starting trials, yeah. And I think they either have started or they will be starting trials soon. And I wouldn't be surprised if, in a year's time, we're just vaccinating children for this routinely. But no, you're right. The reason we haven't is nothing to do with, it's not about worry about there being unsafe. It's just what we routinely do for new treatments and medications. But we are starting trials in children.
I just want to say, I know people say that children are not do not necessarily get that unwell. I've had one of the youngest babies to have caught COVID and have Kawasaki. Go and read up about Kawasaki. People have no issues with reading about all these conspiracy theories. Read about Kawasaki disease, okay? Youngest baby, the types of medication that poor baby is on. Mashallah, the baby has survived. Mashallah, the baby is thriving. The medication that child has to take on. I've also had a child that was in ITU. The father rang us and thanked us for saving the child's life. They became seriously unwell. So, there are children out there who have serious illnesses who are at risk of having nasty effects to COVID. So yes, the reason for the trials are because we need to protect those children as well. So, just want to make that clear.
Yeah, because if there was no benefit to these children having the vaccine, we wouldn't be testing to see if they needed to have it. And there will be some children who are vulnerable because of other illnesses. They may have transplants or other illnesses, and those children will be contacted by their specialists, and those discussions will happen with their parents about whether the vaccine is safe for them now or not. So it's not a blanket no, just like anything. But it will be, if you are contacted about your child who's vulnerable for whatever reason, please go and speak to your doctor. They will take the time to explain everything to you. The decision is ultimately down to you as a parent, and that will not change.
Okay.